Mr. Sullivan.
Thank you, Mr. Chairman. I appreciate the opportunity to speak today. I'm strongly opposed to H.R. 3200, the so-called Americans Affordability Health Choices Act of 2009. H.R. 3200 is not true health care reform. It is a $1.5 trillion government takeover of our health care system. This bill has the potential to force more than 1 million Americans off their current private health care plans where they have choices and into government roles with government bureaucrats and advisory boards making health care decisions for all Americans. The ability of Americans to choose their own doctor and health care plan that best fits their needs is in danger of coming to an end. Instead, this bill could ration care and mandate a subsidized, one-size-fits-all government-run coverage model on most Americans. I'm particularly concerned with the number of new government programs that are created in this bill. Rather than improving health care coverage affordability by eliminating waste, spending currently in the health care system, this legislation is adding at least 31 new federal programs, agencies, commissions, and mandates that accompany this unprecedented government takeover of health care in America. This tells me that the Democrats are not serious about taking a hard look at waste, fraud, abuse, and government health care programs currently on the table. The majority claims that the government-run plan will compete on a level playing field with other health care plans. However, there is nothing in the bill that suggests that be true. The government plan will pay Medicare rates, and it won't be subject to a whole host of costs and liabilities that other private plans must face. H.R. 3200 also includes several damaging new employer mandates that will raise the cost of doing business even higher by penalizing employers, including millions of small businesses who cannot afford to pay for health care. These new mandates will mean even fewer jobs. The Democrats like to talk about this bill as an economic driver, but according to the National Federation of Independent Businesses, they recently warned that 1.6 million jobs could be lost as a result of an employer pay-or-play mandate on small businesses. We can all agree that our nation's health care system is in need of reform, but it should not come at the expense of our nation's small businesses. I look forward to examining this legislation in greater detail during what few days the majority has provided us to examine the largest government takeover of our health care system in our nation's history. And I yield back the balance of my time.
Thank you very much, Mr. Sullivan.